Well, a third case of MERS has been reported in Illinois.
And what's concerning about this case is that it may have been spread by a simple handshake. CBS 2's Dr. Max Gomez is here to tell us what this all means now. Dr. Max?
That's right, Maurice and Christine. This is the first known case of human-to-human spread of the MERS virus to someone who had not come from the Middle East. The other two cases in this country had been healthcare workers in Saudi Arabia. And while the disease was apparently transmitted casually, it might not be as scary as it sounds. Health officials say an Illinois man who had business dealings with the Indiana MERS patient has tested positive for the virus. It's the third confirmed case in the United States and the first person-to-person case here. The Centers for Disease Control says the virus probably spread during a meeting that involved no more contact than a handshake during two business meetings. But health experts still believe the risk to the general public remains low.
I don't think it changes much. It remains a fact that the virus has not spread widely among communities.
Dr. Roberto Posada, an infectious disease specialist, says that even an apparently casual contact like a handshake could still be a good way to transmit a virus. For example, if the MERS patient had coughed or sneezed into his hands, then shaken hands later, and that person rubbed his eyes or nose, that could transmit a respiratory virus like MERS. What's more medically revealing is the fact that this third case was not sick, had no symptoms. He tested positive by screening procedures that health officials have undertaken, trying to track all possible contacts of the two U.S. MERS patients.
The implication of that, it's a little bit early to know for sure, but the implication of that is that perhaps the virus is not as lethal as we initially thought, that there's more of a spectrum of disease, that some people get sick and have no symptoms, or some people get infected and have no symptoms, some people might get minor symptoms.
The CDC has posted warnings about the virus in U.S. airports, but does not plan to take any further precautions at this time. Now, health experts do say that if you've traveled to the Middle East or had close contact with someone who's been there recently and developed flu-like symptoms, fever, cough, chills, body aches, or sore throat, see your doctor and make sure you tell him or her about your travel history.